My story begins where all good stories should, and that is when I used to be cute. I had a very happy childhood, and as you can see, I certainly wasn't short of cuddly toys. I certainly didn't think about cancer much. My only experience was that of my grandfather, who died when I was 12. He'd smoked all of his life and ended up dying of lung cancer. It was very upsetting, of course, but I could rationalise that in my mind. It sort of made sense. In the summer of 2002, when I was 17, I had glandular fever and was admitted to hospital. I felt terrible at the time and had about 5 weeks off school, but did manage to get over it, despite the fact that the right-hand side of my neck remained swollen. But this never really bothered me, and I began university in September 2003, eagerly looking forward to everything that university life would bring. It all began so well. I was making so many new friends and literally having the time of my life. And I thought that I was invincible, which meant that I certainly wasn't worrying about that lump in my neck, even though it seemed to be getting bigger. As an 18-year-old, I'd never imagined it could be anything so serious, especially as I had no other problems and no other symptoms. And for this reason, I kept putting off going to see my GP. After some encouragement from my parents, I'm pictured there with my mum, I did finally go and see my GP, who was quick in carrying out investigations such as x-rays and blood tests. Despite the fact that these came back negative, he was concerned as a lump had been there for so long, and so referred me to a specialist at the hospital who recommended a biopsy. However, the surgeon at the hospital felt sure that it would turn out to be a cyst. 2 weeks after surgery, he broke the news. Tom, we've got the results back from the lab, and they're saying you've got something called Hodgkin's disease. Now, it's not cancer, but it is serious. Luckily, I had a Macmillan nurse on hand to explain things a bit more carefully. While my surgeon had gotten it wrong, my GP had been excellent and followed it up. My late diagnosis was down to the fact that I'd never imagined it could be anything so serious, and so continually put off going to seek advice. Once I'd been diagnosed, the first thing I did when I got home was to go on Cancer Research UK's website and look up absolutely everything about Hodgkin's. While I wouldn't necessarily recommend this, it did show that even from day one, I was eager to discover absolutely everything about my illness. The first time I met my haematologist, he sat with my parents and myself for over 2 hours, mainly answering my questions. I wanted to know why the cancer had developed in the first place, how the drugs would work to kill the cancer cells, and how this also meant that they would cause side effects. It was clear for me right from the beginning that knowledge and understanding were the key to how I would deal with my illness. This was particularly important once treatment had begun. Health professionals that I'd never met before wanted to give me chemotherapy drugs that would make my hair fall out, make me feel exhausted, put me at an increased risk of infection, make me sick, and possibly infertile. This I found very difficult to get my head round. It didn't seem fair. All of those side effects to rid me of one symptom, the painless swelling in my neck. That was one of the hardest aspects for me, and still is one of the most difficult things to try and explain to other people that haven't had cancer. Suddenly, decisions that were affecting not just my everyday life, but possibly the rest of my life, were being taken by other people. In fact, it seemed by everybody but me. 6 lots of chemotherapy followed, but luckily I managed to stay on at university, spending about a week at home after each treatment. I'm pictured there with my dad, and then a week back in Sheffield. Although the 4 chemotherapy drugs I received were given intravenously, I actually found it more difficult to take the oral medications that were given alongside to counter the side effects of treatment. I had great difficulty swallowing tablets, and so was given the orodispersible version or told to try and dissolve them in water. Unfortunately, these methods made me feel even more nauseous. This, coupled with the severe nausea and vomiting from the chemotherapy regimen I received, resulted in me feeling very ill. By the end of treatment, my consultant had even told me to stop taking the oral medications altogether. I also suffered with significant anticipatory symptoms. Often I'll be vomiting before I'd even had the treatment because I was so anxious. After chemotherapy, I had a CT scan, and I always put a picture of a CT scanner if no one's seen one before. And luckily it stated there were no further signs of cancer. However, I then went on to receive radiotherapy once a day for 4 weeks to maximise the chances of the cancer not recurring. The hardest part lay in wearing the mask and having it fixed down to the table. During the 13th treatment, I suffered a panic attack, and after this, I again had to deal with anticipatory symptoms before each treatment. One thing that did make radiotherapy easier was the fact that the department opened late into the evening, and so we could travel outside of rush hour traffic in what was often a 2-hour round trip anyway. So after radiotherapy, what then? Was it back to normality? Back to having a good time? Well, actually, it wasn't as simple as that. I actually found life much more difficult after treatment. I can look back now and see I always had a predisposition to feeling anxious. My illness brought it out in me. Suddenly, there were less appointments with my consultant. I now only saw him every 3 months. Who did I look to for reassurance? I still had many questions to ask, and I still felt out of control. I could never have gone back to feeling how I did before treatment, and in fact, nothing could ever be the same again. This reached a critical point about 18 months after treatment. I was constantly thinking I'd found lumps. I was booking emergency appointments, and I thought I could actually feel them. I couldn't sleep, I felt sick, and generally just couldn't function properly. I went to see my GP, who diagnosed me with depression and an anxiety disorder. And so I began taking antidepressants and had cognitive behaviour therapy, which did help a great deal. As I stated earlier, throughout treatment, one of my coping mechanisms centred around gaining as much information about my illness as possible. I was particularly inspired by my haematologist and my GP, and so by the end of my history degree in 2006, I'd already started thinking about the possibility of studying medicine. I was put off for a while due to the fear of debt, time, and knowing nothing about science. But after plucking up the courage to ask family, friends, and the people that treated me, nearly everybody said yes. So, after graduating in 2006, I successfully applied for a job in a hospital pharmacy, as I wanted to get experience in a hospital to see if medicine was really for me. But I didn't get a job in any hospital. I made sure I got a job in the hospital where I had chemo, a place that simply thinking about made me feel sick. I was determined to get over my fear and not let the cancer continue to control me. The 2-year training post to qualify as a pharmacy technician not only enabled me to learn to love assembling Venalinks, but also to view things from the other side of the dispensary. Having been a patient, I was able to recognise the importance of communication with patients and how this can help massively in terms of compliance and satisfaction. During this time, I still had some problems associated with depression and anxiety and the fear of recurrence of my illness. However, after visiting my GP, I was told there was a 2-year wait for cognitive behaviour therapy, and all she could offer me was to take citalopram again. I didn't want to be put on tablets again. I knew that I needed to talk to somebody. However, my change in postcode meant that the offer of help had also changed. The pharmacy role really cemented my desire to study medicine, and luckily I gained a place back at university, and so returned in September 2008 to Sheffield. I'm currently just over halfway through, and can only ever see myself working in the area of oncology, treating and understanding cancer patients in the future. There's no doubt that if I'd not had cancer, I wouldn't be where I am today. I had done some work with Macmillan Cancer Support, who'd helped me massively when I was ill. And at a conference at the end of 2008, I met a nurse consultant who invited me to join a group in Sheffield as a user representative. Through this group, I began to meet other people who'd had cancer at a young age. The only other young person who'd had cancer previously that I'd met had been somebody I knew at university when I was actually ill. He'd only gone to see his GP because he'd heard of my own diagnosis. So in 5 years, I met only one other young cancer patient. Through joining this group, I've become involved in various streams of cancer research, including the National Cancer Research Institute, where I've helped to represent young people with cancer. This NCRI work also led me to discover the Teenage Cancer Trust, and I've since been lucky enough to work with them and experience the fantastic support that they offer. This again demonstrates how it was my postcode that determined my treatment and why I missed out on age-appropriate care at that time. 8 years after treatment, I'm pleased to say there's been no evidence that my Hodgkin's has returned. As a population of survivors of teenage and young adult cancer increases, the issues of survivorship and the late effects of treatment are becoming increasingly important, and I now attend a clinic that specialises in late effects. The most frustrating aspect for me has been the recent revelation of the potential long-term implications of therapy that I received. I was never told by any health professionals that doxorubicin could harm my heart, that bleomycin could affect my lungs, or that vinblastine could cause peripheral neuropathy. Fortunately, these potential effects have not materialised, but it is only because I asked my GP to refer me to the late effects service that I've been able to have echocardiograms and lung function tests to check. More recently, I've been found to have low levels of testosterone. I was never checked to see if this was low, nor was I ever told to look out for the symptoms. I now face the dilemma of trying to work out if I have been symptomatic for the last 8 years, and if I want to begin what will be lifelong replacement therapy. I also have declining thyroid function due to radiotherapy, and the question of whether my fertility has been affected still needs to be resolved. Communication helped me so much through treatment. I wanted to know everything about my illness, and that became my major coping strategy. Only over time have I realised actually communication was lacking in so many ways, and that this could well have had a detrimental effect on my health. Despite this, I do believe that overall, cancer has changed my life for the better. I certainly wouldn't have gone to a cancer conference in Auckland last year and then thrown myself out of a plane. Through my experience as both a patient and from my time working in a hospital, I've been inspired to pursue a career as a doctor, to be able to use my background to impact on how I treat patients in the future. I think so many people who've had a diagnosis of a serious illness desire to have some control back in their hands. Patients need to be reminded that the one person in the world who can empower them more than any other is themselves. However, this can only be achieved through patients being given the correct information and coping strategies during and after their illness. Health professionals need to do their part too. Thank you very much.